If you're pregnant and your blood sugar levels are high, what does it mean? It means that you have got gestational diabetes mellitus. Now there can be two case scenarios. One is that you were already a diabetic before pregnancy and it's been picked up now first time during your pregnancy. The second scenario is that you have developed diabetes during your pregnancy itself, and once the baby is born, then your blood sugars will come back to normal. Now this is known as gestational diabetes mellitus. Now why are we so worried, or why should we be picking up high blood sugar levels during pregnancy? Now this is so because high blood sugar during pregnancy is associated with many complications, both for the pregnant mother as well as her growing baby. And secondly, because mothers who develop diabetes during pregnancy, they tend to develop type 2 diabetes mellitus later in their life, meaning thereby that once the pregnancy is over, their blood sugar levels will come back to normal, but 5, 10, 15 years down the line, they will develop diabetes. And so it is very important to keep such women for follow-up lifelong. And that is why we are so very particular that blood sugar, if high during pregnancy, should be picked up at the earliest. Now, to understand what happens to blood sugar during pregnancy and why not all women get gestational diabetes, only a few of them get. For this, we need to understand glucose metabolism during normal pregnancy. Now, the maternal glucose is the main energy source for the developing fetus. The blood glucose of the mother crosses through the placenta and goes on to the fetal circulation, and baby uses this glucose as its fuel, as well as it uses this for its development. So there are some physiological changes during pregnancy which keep the maternal blood sugar levels high. So what happens is that during pregnancy there is insulin resistance, and this happens because of the pregnancy hormones like estrogen or human placental lactogen or steroids which are secreted by the placenta. So even there is increased glucose, but because of insulin resistance, this glucose is not taken up by tissues like muscle or fat, but it stays in the blood so that it can be shifted over to the fetus. Now with increased blood glucose, there is increased insulin secretion also, because insulin is the main hormone which regulates the amount of blood sugar. So now because the blood sugar is high in the mother's blood, so insulin secretion also it increases to counteract this increased glucose. So throughout pregnancy, there is a very fine balance between increased blood sugar, increased insulin resistance, as well as increased insulin secretion. So the women who are more prone to get gestational diabetes, or the women who actually develop gestational diabetes during pregnancy, this happens in them because of decrease in insulin secretion. Normally the insulin secretion which was to increase does not happen so in them. It could be because of pancreatic cell dysfunction or delayed response of the pancreas to secrete insulin. So whatever the reason, their insulin secretion does not increase, and that is why their blood sugar remains high and they get diabetic. Another important thing is obese women. Women who have more weight, in them basically free fatty acids are also more in their blood, and this is used for producing energy in such women. And also when there is increased fatty acids in the blood, they stimulate the liver to secrete more glucose. So because of these two reasons, obese women are more prone to get diabetes during pregnancy. Now let's discuss what are the other risk factors for developing diabetes during pregnancy. Now if the pregnant woman is more than 40 years of age, if she has increased blood pressure, if she is obese, or if she has a first degree relative who has diabetes mellitus, if this woman has a history of PCOD, all these are risk factors that she would develop gestational diabetes in her pregnancy. Also, if the woman during her previous pregnancy had gestational diabetes, or she had a baby whose birth weight was more than 4 kgs, these again pose a risk of her developing gestational diabetes during this pregnancy also. Now, we are so worried about increased blood sugar in the mother. But then how do we diagnose gestational diabetes in the pregnant woman? Now, according to the American guidelines, they recommend a two-step approach, meaning thereby that first they test the pregnant woman with a glucose tolerance test using 50 grams glucose. So the woman ingests 50 grams of glucose, and then her blood sugar level is measured after 2 hours. In case this level is more than 140 milligram per deciliter, then she undergoes a second test. Now this is a 100 grams oral glucose tolerance test, and if any two values of this test come out to be abnormal, then the woman is diagnosed as gestational diabetes. Now, according to the WHO guidelines or the Indian guidelines, we do a one-step 75 grams OGTT or oral glucose tolerance test. So the woman dissolves 75 grams of glucose in about 300 ml of water, and then she drinks this solution within 5 minutes. 2 hours after ingestion of this solution, a blood sugar level is taken, and if this is less than 145 milligram percent, then that means that the woman is screened negative, and in case it is more than 140 milligram percent, then she is screened positive. Now, if the woman is screened negative, then the test is repeated again at 24 to 28 weeks of pregnancy. So you do a 75 grams OGTT first at the first contact with the pregnant woman. So whenever she comes to you, you do a OGTT with 75 grams glucose, and in case this is negative, you repeat the test again at 24 to 28 weeks of pregnancy. And why do we do so? Because the insulin resistance, it increases with the period of gestation of pregnancy. So it has been seen that maximum insulin resistance is in the second or third trimester, and that is why patients or pregnant women who were screened negative initially might become positive or might become diabetic in the second or third trimester. So this test is done twice, and there should be at least a difference of 4 weeks between these two tests. Now, what about a woman who comes only late? She comes at say about after 28 weeks of pregnancy. Then this test is only done once. You do not repeat the test again in such women. Now, why are we so worried that a pregnant woman should not develop diabetes during pregnancy? And if she does develop diabetes, then it should be picked up as early as possible. Now, this is mainly because diabetes during pregnancy has been linked to many complications. So, there can be complications in the mother and there can be fetal complications. So, what are the main maternal complications? So, a pregnant woman who has high blood sugar can also go on to develop high blood pressure during her pregnancy. She can have recurrent urinary tract infections. She can have polyhydramnios, that is, there is an increased amount of fluid around the baby. Such women also have a high risk of instrumental deliveries, either forceps or venous delivery. Also, these women have increased chances of cesarean section. Now, because the birth weight of their babies is generally more than 4 kgs, and the labor also does not progress normally in these women, so they land up more in cesareans. They also have increased incidence of postpartum hemorrhage. Now, it's not only during antepartum or during delivery that they have problem. More than half of these women become type 2 diabetics later in their life, and that is why they are kept under follow-up for life. Every 1 to 3 years, OGTT is done on them so as to pick up type 2 diabetes at the earliest. Now, if we talk of fetal complications, they are in the form of increased incidence of abortions, there are increased incidence of prematurity, of respiratory distress syndrome, there are more birth injuries because of large baby and shoulder dystocia. They have increased chances of congenital abnormalities also, but that is seen more in women who are diabetic, who have diabetes before they become pregnant, because as you know, most of the fetal organs are forming during the first trimester, and if the blood sugar levels are high during the first 3 to 4 months of pregnancy, then these babies tend to have more congenital abnormalities, and these are mainly seen in the brain, spine and the gastrointestinal tract. Then these babies can also have a stillbirth, that is that they can die in utero. They have more chances of respiratory distress syndrome because high levels of sugar in baby's blood prevents normal lung development of the baby. Now, once the baby is born, the baby can have low sugar, that is hypoglycemia. Baby can have low calcium, that is hypocalcemia, and the baby can also be jaundiced. Such babies also go on to develop childhood obesity as well as type 2 diabetes mellitus in their adulthood. Now that we know gestational diabetes is associated with so many complications, so can we prevent gestational diabetes mellitus from happening? Making lifestyle changes before you become pregnant can of course prevent gestational diabetes, meaning thereby that if you take a good diet, you have an active lifestyle, you keep your weight in check, then and all this you are doing before you are pregnant, then once you get pregnant, then obviously your risk for developing gestational diabetes is very low. But once you are pregnant, we obviously don't advise you to lose weight, but we generally recommend how much weight you should gain during pregnancy. Now, if you are a normal weight woman, then generally during your pregnancy, you will gain somewhere around 11 to 16 kgs. But women who are overweight, that is their BMI is between 25 to 30. So we generally recommend them that they should gain anywhere between 7 to 11 kgs of weight. And women who are obese, that is their BMI is more than 30, we generally recommend that they should gain anywhere between 5 to 9 kgs of weight during their whole pregnancy. So be aware and be safe.